Today I'm going to be talking about antibiotic resistance. Imagine how a small cut, a sore throat, or routine surgery could become life-threatening. This is an example of the danger of antibiotic resistance. Antibiotic resistance is when the drugs that are meant to kill bacteria or stop their growth no longer work. It's really important to understand that it's not the patients themselves that become resistant, it's the bacteria. Once resistant bacteria survives, they multiply and the infection becomes harder to treat and it prolongs the process. And bacteria becomes resistant by two main ways. One is mutation in the bacterial DNA. These are random changes. We don't really have much control over them. But sometimes these mutations give bacteria an advantage, like making the drug's target site no longer work because it's slightly different, so the antibiotics can't attach. Another way is that bacteria can share its resistant genes with other bacteria, kind of spreading that resistance and making it harder to treat. It can do this by swapping plasmids and transformation. Um, Once bacteria becomes resistant, um, it can make enzymes that destroy the antibiotic. It can block the drug from getting inside it in the first place. And once that happens, it's really hard, regardless of the medication, to kind of stop that. Ways that people contribute to this, or multiple ways doctors contribute to this resistance by overprescribing or misprescribing antibiotics if a patient's on them and they don't really need them. For example, if you have a virus that's for like a cold or the flu and you're prescribed antibiotics, antibiotics aren't going to do anything because you have a virus, and they only treat bacterial infections, not viral. Another way this can happen is broad spectrum antibiotics. Broad spectrum antibiotics target a wide range of bacteria, and because of that, it can build a resistance to ones it's not dealing with, whereas specific spectrum antibiotics target specific bacteria it's trying to infect, and that has seems to be more effective and causes less antibiotic resistance when prescribed a specific spectrum antibiotic. Patients also contribute to this, though, by not finishing their antibiotic treatment. A lot of times when patients feel better, they tend to be like, oh, well, I don't need to finish my treatment anymore because, I'm feeling better. The reality is that just killed off some of the weakest bacteria, but you still have stronger bacteria now building a resistance because it didn't finish and wipe them all out. So when this happens, it builds resistance, and bacterial infections such as MRSA occur, and it's really hard to treat that. It's a lot more of a long process, and it can become life-threatening. Antibiotics, just in summary, antibiotic resistance is when bacteria evolve in ways that can survive drugs that are used to kill them or stop their growth. They do this by mutations or by sharing resistant genes, and they use strategies like destroying the drug or pumping it out of their cells to build that resistance. Doctors can worsen these problems by overprescribing or misprescribing antibiotics, and patients can also worsen this by not finishing their prescribed doses. Everyone can contribute to this and make it better by patients finishing their dose and being responsible for finishing their doses that are prescribed to them. And doctors can contribute to this by maybe using more specific spectrum antibiotics and not overprescribing antibiotics or misusing them. For example, if like I said earlier, if you have a virus. Um, by implementing some of these strategies, we can fight off antibiotic resistance. And so that way we don't end up with more antibiotic resistant drugs, or not drugs, there's infections like MRSA. Thank you. Bye bye.